name is Tanya Babitch, and I'm the Assistant Vice President of the Risk Management Department at TMLT. In this video, we'll review the process for terminating a patient relationship, including how to write a dismissal letter. Termination of the patient-physician relationship should be a last resort. To avoid termination and give the patient another chance, consider these steps. Counsel the patient to improve noncompliant or disruptive behavior. Prepare to have the conversation more than once and document it. Firmly tell the patient that you'll terminate the relationship if they do not comply. For patients with an unpaid balance, offer a payment plan that is mutually agreed upon. Document your efforts to help in the billing portion of the patient's records. If this doesn't work, send a letter explaining that failure to pay may result in termination. Keep in mind, the patient's records cannot be withheld from another physician or from the patient because of an overdue balance. Every termination process must be tailored to the individual patient. Before dismissing a patient, ensure the following. The patient is not in an acute phase of care, the patient will receive appropriate notice, and the patient has had the time and opportunity to find another physician. Also, research the patient's insurance provider contracts. Some providers may stipulate that the physician must accept certain patients and that specific steps must be followed to dismiss a patient. Be sure you follow your state medical board rules or laws that address ending a relationship with a patient. All patients must be treated equally. A patient may not be terminated simply because they have a disability that requires special accommodations. If you ultimately decide to end the relationship, the next step is to notify the patient and document the termination. A good way to do so is to send a dismissal letter. The letter should be printed on office letterhead. We recommend sending by both first-class mail and certified mail with a return receipt requested. Keep a copy of the dismissal letter and return receipt in the patient's medical record. Some physicians may consider sending termination letters electronically via a patient portal. This can be complicated as documentation that a patient accessed and reviewed the letter should be tracked and retained. Before using this method, check applicable state laws and with your medical board about whether this method would be acceptable. In the letter, tell the patient that the relationship will end in a specific time frame. Recommend that he or she find a new physician before that time runs out. Set the time limit based on any state requirements, your specialty, the size of your community, and availability of other physicians. Give the patient a reasonable amount of time to find a new physician and be available to the patient until that period ends. Be factual. Don't include anything in the letter that can be construed as inflammatory by the patient, a state medical board, an attorney, or jury. There's no need to recommend a specific physician, clinic, or group. Instead, describe in general terms how the patient can find a new physician. This could include referring the patient to his or her health insurance company's list of providers or county medical society to find a new provider. Include an authorization for the release of the medical record with the letter. Ask the patient to designate the new physician, complete and sign the form, and send it to your office as soon as possible. Forward the patient's record promptly. Something else we recommend when you end the relationship: don't charge the patient for copying the medical record. Don't forget to tell your office staff, especially your scheduler, about the dismissal and the effective termination date. If using an electronic health record, alerts may help prevent accidental scheduling of the patient after the termination date. If you're in a group, consider formally terminating the patient from the entire group. Clearly state in the letter that the relationship is ending with the group. If the patient states that they are ending the relationship with you, follow up with formal written confirmation. Documenting all actions and conversations is your best defense against allegations of patient abandonment. To see sample letters or learn more about ending patient relationships, please visit our website at tmlt.org. Thanks for watching.